First procedure is to check for the doctor's order and assess whether the patient is allergic to iodine or plaster, and then perform hand hygiene. This is to deter the spread of microorganisms.
Identify and explain the procedure to the patient. An explanation reduces apprehension and encourages cooperation.
Sige sir, i-check sa na ko yung ID band sir ha. So sir, na-inform naman ko ni Dr. Sir no, nga kaning na ay catheterization nga i-ano sa imo ha, aron ma-drain ang imong ihibikan sa imong tantok sir. Okay po sir. So mubalik lang ko diri sir, mag-antog sa akong mga gamit sir. Salamat!
Next procedure is provide a good lighting is necessary to see the meatus clearly. Then provide for privacy by screening and closing the door or window.
With the patient supine and knees slightly apart, drape by fan-folding the bed covers down to the mid-thigh, exposing the perineal area, and use a bath blanket to cover the trunk. Draping keeps the patient warm and reduces embarrassment.
Open the back aseptically and place it on the bed at the level of the hips. Bring the sterile kidney basin near the working area.
Placement of the equipment near the working site increases the efficiency, and sterile technique protects the patient and prevents the spread of microorganisms.
Squeeze a small amount of lubricant over the sterile OS.
Get 2 cotton balls with betadine from the jar and place on the sterile field on top of the several OS.
Next is to don sterile gloves. This is to protect the nurse from infection and to maintain the sterility of her working surface.
Next procedure is to place the opening of the fenestrated drape over the penis and onto the perineum without touching the upper top surface.
Lubricate the Foley catheter around 3 to 4 inches.
With a non-dominant hand, lift penis to position perpendicular to patient's body and cleanse in a circular motion moving outward from the meatus down to the base of glands with the use of cotton balls with betadine.
Using dominant hand, slowly insert the catheter in the meatus about 7 to 9 inches using a rotating motion until the urine flow.
Hold end of the catheter loosely coiled in palm of dominant hand. If resistance persists and the catheter will not advance, remove it and notify the physician.
Next is to inject content of pre-filled syringe to secure the catheter.
Next procedure is to gently push the catheter in 1 to 2 inches more after urine starts to flow. Allow 30 cc or more urine to flow and collect the specimen as ordered.
Then remove the fenestrated drape. Make sure that the contaminated part is inside.
Next procedure is to attach the catheter to the urinary bag below the level of the bladder.
Tape the catheter to lower abdomen or anterior thigh.
Coil excess tubing on the mattress and secure it on the bed frame. Proper placement of the urinary bag facilitates drainage and prevents urinary reflux that may cause UTI. Remove and clean the equipment and make patient comfortable. Label the urine specimen and send to the laboratory promptly. Next procedure is to remove gloves and wash your hands. Hand washing deters the spread of microorganisms. And record the time of the catheterization, the amount of the urine removed, a description of the urine, and the patient's reaction on the procedure. A careful record is important for documenting data after the patient's care.